Well, it is the wish of expectant mothers to give birth to healthy babies, but what happens when the mother gives birth to a baby with a medical condition that is unknown to her? Our health reporter, Nuru Abdulaziz, visited a 15-year-old Francis Kimani who was born with a rare condition that affects the vein and arteries known as arterio-venous malformation. His mother, Rachel Wamboi, had been seeking medical assistance and finally got it after a long search.
It is here in Gertrude that we met 15-year-old Francis Kimani Wangui, who was born with an arterio-venous malformation, AVM.
Nikajikuta mkono imeanza kufura, ikafura venye nakuwa inaenda ikikua. Nilipoingia shule class 1, watoto wadogo wakiona mkono wanapotea, wanalia. Tukicheza mara nyingine nilikuwa naanguka inavujika.
Although the condition may not reveal any noticeable symptoms, it can cause intense pain or bleeding or lead to other serious medical problems.
If this malformation occurs in an internal organ, it may not be possible to see it, but that swelling can cause some effects due to pressure. So if it's in the brain, one can present with signs similar to a stroke, or unfortunately, if it bleeds undetected, it could be a cause of a sudden death.
After suffering from the condition for 14 years and sitting his KCPE exams in 2012, which he passed well, Kimani finally got the much-needed medical help that his mother had been seeking for years, courtesy of the Gertrude's Hospital Foundation.
Sahi hata sisikii vibaya sababu nilikuwa natumia hii, haiko inanisaidia.
Mimi nilijaribu nikashindwa. Hakuna dawa inaweza nipatia. Ilikuwa hiyo mkono ilikuwa ni damu na haikuwa na mishipa. Sasa hapa palikuwa soft sana. Saa zingine akiwa naoga inakatika, inatoka damu. Tena akashikilia tu hivi.
Nikafanya KCPE ya 2012, kapata 306. Sikuwa nikifanya vizuri sababu nilikuwa nasikia mkono ni zito. Siwezi cheza kama watoto wale wengine.
But what should all mothers keep in mind?
If you see any abnormal swelling, please present to hospital. Don't just imagine it's an innocent swelling. It could be an AV malformation. Major symptoms is actually an obvious swelling in the affected area. The area may be one or could be more than one, but it is a clear swelling that looks abnormal, and this tends to grow with time. Most of the time it gets bigger. The major risk of it is actually bleeding.
AVMs affect 1 in every 500 children that are born. It is more common in males than in females. Arterio-venous malformation is not hereditary. This simply means that Francis here cannot pass it on to his future children. For your well-being in Gertrude, I'm Nuru Abdulaziz.